All right, so here we are with John, and we fixed his knee earlier this week, as some of you saw in the video, but now we're going to address his the disc herniations he's got in the very lower part of the neck. Luckily, he does not have numbness or tingling in his hands, right?
No.
Did you have it at all?
No.
Okay. He doesn't have pain shooting down his arms, and I'm saying this so you know that's something that can happen. So if you ever feel that, that's coming from your disc herniations in your neck. And the discs in the neck control different sensations in different parts of the body. So when you do have that numbness, it's important to go and tell the doctor exactly where it's numb, in your pinky finger versus your middle finger versus your thumb. Okay, those are three different nerves. Could be C6 is your thumb, 3-7 is the middle finger, T1 or C8 is the pinky finger. So, important to pay attention to that when you do have that, or if it's numbness up here in the upper arm or up at the top of the shoulder. That can also come from a nerve in the neck, usually caused by a disc herniation, again, or a disc bulge. So we're dealing with that. He does have pinched nerves on both sides, according to his old MRI. It's not that old, but anything within a few years is fine as long as you haven't had trauma since then, okay? Then you might need a new MRI. So, and the fact that he's not having pain or numbness down his arms is a good thing. So I don't think we need to get another MRI for him. If he was having pain shooting down his arm for over a month and it was not getting better with the care, then that's certainly a reason to have an MRI done, or even at that point a nerve test, an EMG or NCV test, which we do here. But ultimately the gold standard is using an MRI to diagnose this problem. So we're going to go ahead and loosen up the muscles here before we adjust him, and we'd like to use this PTLMS machine. It's loud, so plug your ears. I'd like to note that he also has scoliosis. So he has a levoscoliosis in the thoracocervical area, which is not as common as having it in the lumbar or the lumbar thoracic region. Okay, so he has it in the upper thoracic into the neck to the left. So his head leans or tilts to the right. So you're going to see me right now open his posture up here to the right. So we're going to tilt this table. The headpiece moves. And we're going to hold that open to the left side and open up this right side, sort of reversing that scoliosis curve. So because of his scoliosis, he originally came to me for costochondritis. So, which is chest pain for some of you that are watching this and don't know that. And it's very debilitating. Can even cause panic attacks, heart palpitations, chest pain while you breathe in and out. So he started having that, and he's susceptible to the costochondritis because of the scoliosis. So the underlying issue here is the scoliosis creating the chest pain, the costochondritis, and now making his disc herniations at the top of that scoliosis, or right in the middle there, more susceptible to being flared up. When you have disc herniations, they take time a little bit to heal, and anywhere up to 3 months. Typically, though, we're able to get that down to 4 weeks, 5 weeks. So he's already showed some improvement in a few treatments. So we're going to continue with what we're doing, but we have some other things that we can do in this situation. If he's not responding to chiropractic, some soft tissue work, and traction or decompression to the cervical spine, then we use cold laser therapy, and we haven't even really had to use that yet, but that's an option for us should we need to. So go ahead, take a deep breath in. So you'll see here I'm standing on his left side for a reason, because of the scoliosis, and blow all the way out. So he would not want to get a massage with the massage therapist standing on the right side, massaging and pushing his spine to the left. That'll aggravate it, you know. So there's a reason why I stand here on this left side. Take a deep breath in. Good. And blow all the way out. And blow all the way out. I'm standing on his right side because we're doing a different type of adjustment here. And just take a deep breath in. Good. And blow all the way out here. Okay, turn over on your back. So we just adjusted him. Now we're going to do a little bit of spinal decompression or cervical decompression on his neck. Cervical means the neck. It's just another word. It's a technical term, a medical term for the cervical or neck, the spine in the neck. Yes. All right, good. Relax there. Take a deep breath in. I've done some videos where you can do this at home with a pillowcase. That's an option. Sometimes we do that, and sometimes we use a decompression table or machine, and sometimes we just use a Y strap. I'm going to get the Y strap. Okay, lift your head up. Yep. Drop it back. And you'll notice I don't yank hard on the neck. We do a gradual pull up to about 40 to 50 pounds of pressure pulling. And then sometimes I'll just do a little impulse like that, but very short impulse. Fast, short, and not that violent, as many of you have seen on TikTok or Instagram. That's not the way this should be done. Good. And then I release gradually. How are we doing there? Okay? Mm-hmm. And again, he doesn't have any pain or numbness down the arm, so I typically do this for somebody with numbness and pain shooting down the arm, hands, or fingers. But this seems to have helped him, so anything that helps the patient, we're going to do. So now we're going to do something called stair stepping. What this does is, and it's going to be hard for you guys there on camera, to see this from home, but I'm gliding his neck through all the joints at each spinal level, and I'm looking for fixations where it skips. And I can feel that, and once I feel that, I go to that level and I do some figure eights at that level and get the facet joints, which are really flat, but they're at a 45-degree angle in the neck, get them gliding better and lubricated. And you'll see that someone's neck is just really, really stiff, and then all of a sudden after I do that, it just completely changes. So we're gonna do that here. Just relax your head, take some deep breaths in and out. It's real important that the patient relax their head. There's no adjusting here. It's a very, very gentle motion, as you can see here. Very small motion. And I try to be real quiet, let the patient relax. It's hard for people to relax their head, their neck, in someone else's hands sometimes. John is not having any problems doing it. He's been seeing me for a while, and I've helped him out with some other conditions, so it's a little bit easier. But some patients, it's like their neck's like a ruler. You can't even move it through all the range of motion at each level. So he's a great person to work with here. You guys can see exactly how it works. I'm gonna do it again here. And relax here. Right at the top, there's a little bit of a fixation. Okay, go ahead, sit up, face the camera, sit right on this cushion here. Move your neck around, see how that feels. Bend your head forward, bend your head back. Okay, so I adjusted his thoracic spine, upper thoracic spine, not his cervical spine. We're gonna see how he does with that, without adjusting that cervical spine. We adjusted right below the disc herniations today. And then we tractioned out above that, okay? I wanna see how you do with that. Thanks for tuning in. If you guys have any questions or comments, make sure you comment below. How about you? Any questions?
No.
Okay, you're welcome.
Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.